Okay, guys, let's get started. Today we are really blessed to have two fantastic presentations, and they're from two separate parts of the Cancer Center, two programs from Developmental Therapeutics and also from Cancer Prevention Control. First, we're going to hear from Leah Ferrucci from Cancer Prevention Control, and I've asked Susan Main if she could introduce Dr. Ferrucci's talk.
All right, it's my great pleasure to introduce Dr. Leah Ferrucci to this audience. Leah did her MPH and PhD in epidemiology here at the Yale School of Public Health. And actually part of her PhD work was done at the U.S. National Cancer Institute as part of a partnership program we have with the Division of Cancer Epidemiology and Genetics. And she's a truly outstanding young investigator. Her PhD dissertation paper was recognized as the top paper in the nation for graduating students in epidemiology when she finished. So that was an amazing achievement. She stayed at NCI for just the United States, yes. Okay. She stayed at NCI for a postdoctoral fellowship for a while and then came back to Yale on an individual F-32 grant that she wrote to bring her back to Yale to continue to work with us here in cancer prevention and control. She then wrote a K Award, which was funded, a 5-year K Award from the American Cancer Society, to really put forward her work in skin cancer prevention. So she's been part of a research team that we've had looking at really important aspects of skin cancer prevention, and today she's going to talk about one area of research. So Dr. Ferrucci.
Thank you for the introduction. As Susan mentioned, this is just one part of our skin cancer research, which has also focused on etiology, as well as understanding tanning, so looking at tanning addiction and correlated behaviors. So today we'll be talking about ultraviolet radiation-related behaviors in young skin cancer survivors. And I have no conflicts of interest to declare. As a rough outline for the talk, first we'll look at incidence trends of melanoma and non-melanoma skin cancer, then look at UV-related behaviors in the general population, investigate skin cancer survivors and their risk for subsequent skin cancers, and then we'll present some data which was recently collected in a pilot study that we held in Connecticut among young skin cancer survivors, and finally wrap up with some conclusions and implications of our findings. Non-melanoma skin cancer in the United States is the most common cancer. Each year, approximately 3.5 million non-melanoma skin cancers are diagnosed. And I'll go into this in more detail later, but these occur among 2.2 million individuals, as many people have multiple skin cancers diagnosed. And despite being a cancer predominantly of non-Hispanic whites, this cancer actually exceeds the total number of breast, prostate, lung, and colorectal cancers combined in any given year. Although non-melanoma skin cancer has a low mortality, healthcare costs and healthcare utilization are quite high. Based on Medicare data, we see that non-melanoma skin cancer is actually the 5th most costly cancer to treat. Now looking at malignant melanoma, this is the most lethal type of skin cancer, and despite accounting for only 5% of skin cancer diagnoses, it is the vast majority of skin cancer deaths. In 2014, there will be an estimated 76,000 new cases of melanoma, approximately 44,000 in men and 32,000 in women. And overall, in 2014, there will be approximately 9,700 deaths from melanoma. It's also interesting to look at melanoma by age. So if we look at 15 to 29-year-olds in the US, melanoma is actually the 2nd most common registry-reported cancer in this population. Now moving on to the trends for both of these cancers. Unfortunately, non-melanoma skin cancer is not tracked in most cancer registries. This is simply due to the sheer volume of diagnoses, and it would just overwhelm our current systems. So we have to rely on segments of the population. Some counties capture this. There are other countries across the world that capture this a bit better than us. But within the US, there are data from Minnesota where we can see incidence patterns among young people. And here, from 1976 to 2003, the incidence of non-melanoma skin cancer increased among under 40-year-olds. And a particularly interesting finding here was that there was a disproportionate increase for basal cell carcinoma in young women. Data in an older population, again, we can draw from Medicare billing information, and here an estimated 4.2 annual average increase is seen in an older population in the US. For melanoma, we see similar trends of increasing incidence. In the US overall, there was approximately a 60% increase in melanoma over the last 30 years. And again, honing into that younger age group, we see especially rapid increases in young people, and in this case, women. So those ages 15 to 39, there was approximately a 3% annual average increase observed since 1992. And we saw on the previous slide that the total diagnoses of melanoma is higher in men than in women, but there's actually a gender switch based on age. So in younger populations, women have a higher incidence than men, and that switches in older ages. Looking at skin cancer from a public health perspective, we wanted to look at modifiable risk factors. And for skin cancer, the main one that we can look at here is UV, ultraviolet radiation. So UV is known to be the primary environmental etiologic risk factor for skin cancer. And up until the past few years, most UV exposure had been traditionally from outdoor sun exposure. So looking at some national data, we can see what UV exposure is like in the general population. So from some survey data, we see that 59% of US adults reported that they sunbathed at least once in the past year.
Is that woman who was on Howard Stern?
Oh, I don't know. I don't think so.
What's her name, the sunburn mom?
Oh, no, it's not the indoor tanning mom.
Okay.
This is someone else. So this is someone that likes the outdoor exposure. And then we also see that sunburn is also quite high among US adults, so approximately 37% were sunburned in the past year. What we also see from these national data is that overall younger people have riskier UV-related behaviors. One example of this would be with sunburns. So we look at a younger segment of the population, 18 to 29-year-olds, so you see that over half had reported a sunburn within the past year. And now, in the past few decades, UV exposure has also come from artificial sources, so indoor tanning, tanning beds, and tanning booths. It's estimated that approximately 30 million people tan indoors in the US annually. This represents approximately 5.6% of US adults. Among that 30 million, it's estimated that 2.3 million of these people are adolescents. And because people do this behavior many, many times, this would break down to about 1 million people per day using tanning salons. And just to give another sense of how common indoor tanning is, there was a study conducted in 2006 that looked at the number of indoor tanning salons in 116 US cities, and they found that these salons exceeded the number of Starbucks and McDonald's. So this is a very common exposure now. In 2011, these UV-emitting tanning devices were classified as the top type of carcinogen, so group 1 by IARC, but it's still a very common exposure. And particularly in the US, we've found that indoor tanning is most common among young white women. So most recent data indicate that the highest prevalence of indoor tanning would be among 18 to 21-year-old female white women, with 31% having indoor tanned in the past year. And ever indoor tanning, so just trying indoor tanning once, would be much higher and often is not captured in the national surveys. So this is just within the past year. And then I mentioned earlier that we had multiple skin cancers that can occur in skin cancer survivors. So now we can look at that in a bit more detail. Unfortunately, as I mentioned, we don't quite know how many individuals have non-melanoma skin cancer and are still living with that today, but there has been some work to look at their risk of subsequent skin cancer. So these individuals are at an increased risk of melanoma. Compared to the general population, they would be at approximately 2.5 to 8-fold increased risk. And there's actually a greater risk suggested if the non-melanoma skin cancer is diagnosed at a younger age. These individuals also have multiple non-melanoma skin cancer. So here there's been studies looking at just a second primary non-melanoma skin cancer, and the risk ranges from 2 to 10-fold increased. We've also looked in our own population of early onset basal cell carcinoma patients, and this is drawn from a case control study that was part of the Yale Spore in Skin Cancer. And here we saw that in an early onset basal cell population, approximately 37% of individuals had already had 2 or more basal cell carcinomas under the age of 40. For melanoma, we see we can actually get an estimate of the number of survivors. So in 2012, the most recent available data, there would be approximately 1 million melanoma survivors in the US, and this would represent 7% of cancer survivors overall. And subsequent studies have been done to look at their increased risk of skin cancer. So here we see an increased risk for melanoma, approximately 5 to 15-fold increased risk, and then also an increased risk of non-melanoma skin cancer, about a 4-fold increased risk. While most etiologic research on UV has focused on first primary skin cancers, it's also hypothesized that risk of multiple or subsequent skin cancers may be related to UV-related behaviors after one's first skin cancer diagnosis. Unfortunately, at the moment, there are only limited epidemiologic data on this. One study out of Australia did look at melanoma survivors and saw that they could reduce their risk of a further melanoma by reducing their recreational sun exposure at any age. We've also hypothesized that this type of exposure, so UV exposure after a first skin cancer, may be even more relevant when an individual is first diagnosed with a skin cancer at a young age. So these people have many years at risk both to have the exposure and to develop the disease. Some work has also started to look at the prevalence of UV-related behaviors in skin cancer survivors to better understand this relationship. Most of the studies so far have looked at sun protection practices in this population, and most of the studies have been fairly small in sample size, but they've found some evidence that behaviors may actually not be any better than in a general population sample. And these studies are somewhat limited right now as they've been predominantly in older survivors and predominantly melanoma survivors. And there have only been a couple studies looking at the UV exposure-related behaviors of sunbathing and sunburns. Overall, this seems to be that these behaviors are less common than in general population, but again, it's only based on a few studies. And here, studies have found that approximately 15 to 23% of skin cancer survivors sunbathed after their diagnosis. And then another study found 27% of melanoma survivors reported a sunburn after their diagnosis within a 12-year window. Finally, there's been some work looking at indoor tanning in skin cancer survivors. And again, these have mainly been based on small studies and mostly melanoma survivors only. And the prevalence of indoor tanning after a skin cancer diagnosis has ranged from 1 to 6%. So based upon the pattern that we saw of increasing incidence of skin cancer in young people and the fact that a lot of the riskier UV behaviors occur in young people, we undertook a pilot study in Connecticut to evaluate these behaviors in a young skin cancer survivor population. And this work was funded by a pilot cancer survivorship research grant from the Cancer Center and the Connecticut Challenge. And Dr. Susan Main was the PI for this work. So our pilot study had two components, one quantitative and one qualitative. For the quantitative component, we had a goal of enrolling 200 young skin cancer survivors. We had two groups of skin cancer survivors here, basal cell carcinoma and melanoma. All of our cases were pathology verified. The basal cell group were those under age 40, as they were drawn from our early onset basal cell carcinoma case control study. And those individuals had been originally identified through Yale dermatopathology. We then also recruited melanoma survivors limited to early stage, so stage 1 and 2, and those individuals were identified from the Yale New Haven Hospital Tumor Registry. We also wanted to limit our survivors to those that had been diagnosed within the past 1 to 5 years. And you can see our enrollment here was 99 basal cell and 135 melanoma. Our other criteria were non-Hispanic white, English speaking, having an internet connection as our survey was administered online, and residing in Connecticut. The second part of our work was then to enroll a subset of those people that had completed our online survey to participate in focus groups. And here we limited this to melanoma survivors. So this table shows some of the study characteristics of the participants that completed our online survey. On average, they were 39 years of age at diagnosis, and they were approximately 3.7 years since their diagnosis at the time they completed the survey. we had approximately the 42% basal cell carcinoma. Our sample's predominantly female, and this may just reflect the incidence patterns of skin cancer in young people. And they're also very well educated. Most had a family history of skin cancer as well. And then finally, I'd like to draw your attention to the behaviors at the bottom of this slide. So these are their UV-related behaviors prior to a skin cancer diagnosis. So we see that sunburn and sunbathing are very common, over 80%. And we saw also that indoor tanning was quite common. So 61% of participants had tried indoor tanning at least once prior to their skin cancer. Now we'll move on to some of the data that they reported in terms of their behaviors after their diagnosis. So this slide shows both the full sample combined in the bright turquoise, so all survivors, and then it's broken down by skin cancer type with melanoma in the navy bars and BCC in the lighter blue bars. So overall in the sample, we saw that 27% of skin cancer survivors had reported sunbathing after their skin cancer diagnosis. But if we look at this by skin cancer type, we see that nearly 50% of those with basal cell carcinoma had sunbathed after their diagnosis. Both sunburning and indoor tanning were lower at about 6% prevalence, but again, we saw that pattern of those with basal cell carcinoma being much more likely to participate in these behaviors after their diagnosis. And then I'll just quickly overlay what the general population estimates are, just to refresh your memory on that. Just keep in mind that those estimates are actually among a full adult population, and ours is limited to those under age 50. But it is interesting to note that even among our BCC survivor population, the prevalence of indoor tanning appears to be higher than in a general population sample. Next, I'd just like to pull up a few quotes from our qualitative work. So this woman reports that she was burned after having had her skin cancer, and you can see the distress that it brought her, bringing her back to her first diagnosis. We also saw this theme emerge where individuals still felt that being tan was preferable to being pale. And here you see tanning appearance being equated with making her feel healthy. So there's this interesting juxtaposition that these individuals are facing. And then finally, you see an example here of a woman who probably would not have reported any of the exposures that we saw on the previous slide, where she's reporting that she did not go out at all. She avoids the sun 100%. Next, we'll look at the sun protection behaviors in our full sample. And here, the bars are now going to represent the prevalence of the behavior. And this is for both melanoma and BCC combined. So the bright purple are the behaviors that would have been practiced always or most of the time. The dark purple is practicing those behaviors sometimes, and the lightest is rarely. So here we saw that using sunscreen was the most common UV protection behavior in our population. Approximately 83% reported this. And then we see that the other protection behaviors fall off. Staying in the shade or under an umbrella on a sunny day, only about 50% of people did this always or sometimes. Always or most of the time, excuse me. And then the other, wearing a hat, long sleeve shirt, and long pants are all about 30% or less. And because a lot of the UV protection recommendations actually indicate that people should participate in multiple protection behaviors, we looked at a combined measure. So how many of our cancer survivors practice 3 or more of the behaviors? And here we only saw that 28% fell within this category of practicing the behaviors always or most of the time. And then again, just to reference the general population sample, we'll pull up the figures of prevalence within the US. So we see that sunscreen use in our population is much higher, and shade is a bit higher, but most of the other figures are actually equal to or less than what we see in a general population sample for protective clothing and wearing a hat. And then again, I'll just bring in some of the quotes from our qualitative work with the female melanoma survivors. So this is a theme that emerged quite often. We saw that people were very diligent in the first year after their diagnosis. So this woman says that she was doing all of the recommendations at first and then actually fell off. We also saw another sort of theme that emerged where people were surprised that even though they said that they were using sunscreen as they thought was recommended, they would actually still be getting tanned. And so that was something where they may not have actually been using the sunscreen as they should have. And then finally, this is an example of a woman that likely would not have participated in any of the protection behaviors. So here you see her saying that the damage that she already had done to herself 30 years ago is what's happening to her now, and so she doesn't feel as though changing anything now would actually be of benefit down the road, so she's not following any of the advice. So finally, the last part of our analysis was to look at what are some factors associated with engaging in these behaviors. And first we'll look at the risk-taking behaviors, so sunbathing, sunburning, and indoor tanning. And we saw that in a multivariate setting, skin cancer type was still predictive of who would actually engage in these behaviors. So those with basal cell carcinoma were much more likely to engage in these behaviors. For sunbathing, we also saw that age was related, so older individuals were less likely to sunbathe. And we also saw that individuals who were more worried about their skin cancer were less likely to engage in this behavior. The only other factor which emerged was skin reaction, so those that don't tan very well were more likely to report a sunburn. And then looking at the protective behaviors, so those that practice 3 or more protection behaviors, the only things that we saw that were predictive of this behavior were age and skin cancer worry. So older age was related to practicing protection behaviors, as was worrying more about your skin cancer. So overall, our pilot data confirmed our hypothesis that UV-related behaviors in young skin cancer survivors are worrisome. We saw that approximately 1/4 of this population sunbathed, and this was even higher among our basal cell carcinoma survivors. We also saw that individual sun protection behaviors were only regularly practiced by less than 50%, except for sunscreen use. Based on this information, it seems to indicate that young skin cancer survivors may benefit from interventions that target UV-related behaviors. And the groups that may be best to target are those diagnosed at youngest ages and those with non-melanoma skin cancer. And then in terms of some greater implications of our data, we think that this group is particularly important to continue to study because they're a growing segment of the skin cancer survivor population. And unfortunately, at the moment, UV is one of the lifestyle cancer risk factors that's not typically addressed in most cancer survivorship programs. But it could be a very important exposure, particularly if we see this group of survivors continuing to grow in size. There's also data to suggest that that skin cancer survivors in general are at an increased risk of other cancers. So we need more data to understand if this is a genetic relationship or if there are correlated risk behaviors. And if it's more related to correlated risk behaviors, it could be that this group would benefit from bundled cancer prevention interventions where we target multiple lifestyle risk factors. Finally, to leave you with some future directions of where we could actually help to intervene with this group, I'd like to show some individual and structural interventions that are being developed to look at UV reduction. And most of this work is in primary skin cancer prevention, but it could be translated to our skin cancer survivor population. So using technology, there's a lot being developed where people can actually get an index of the UV where they are. You could even have applications set up that remind people to apply sunscreen depending on the time of day that they're outside. I was at a recent conference and saw an app that's being developed that can read the strength of one's GPS signal from their smartphone and determine if you're indoors or outdoors and give you tailored recommendations based on that. There's also work being done, this is particularly among actually young childhood cancer survivors, where they're charged with trying to monitor their skin themselves and send photo feedback to a dermatologist. And that dermatologist can then triage lesions that might need to be investigated further. We can also think about structural level interventions. So some of our work has been involved in indoor tanning bans and restrictions. So across the world, there are restrictions often for minors for indoor tanning. So this could just change the landscape that individuals have in terms of access to this type of UV exposure. And there are even some countries that have banned commercial indoor tanning beds outright. So Brazil and Australia are those countries.
You don't need the results.
You don't, but apparently they were very common. I think it's once you have the sun, you want more, apparently. And then we can just think about how there might be organized national or state UV reduction campaigns. So could outdoor activities be shifted to off-peak hours? We've heard from colleagues in Australia that children's sports games are moved to very early in the morning so that they avoid peak UV exposure. So could that just be something more coordinated among a state or a national level? Could shade be provided in public places? And schools are a particularly salient place where things like sun protection behaviors could be promoted. And finally, I'd just like to show some of the work that's been done in Australia in terms of cancer prevention campaigns for skin cancer. And this work has really been around since the 1980s. So these are examples of shades that they have installed in playgrounds. This is shades that they have over a car racetrack. And then these are just some of the campaign messages that they have. And you'll see that a lot of the messages actually appear on their public beaches. So we don't really see that very much here, but this has actually been quite effective in Australia. So the data show in Australia that non-melanoma skin cancer rates are actually declining in their young people, and these are individuals that would have grown up with these campaigns. There's also data to suggest that melanoma rates are stabilizing in their young people, and that's not the case in older populations who had not had these types of campaigns in place. We also see that the behaviors are improving, so spending less time outdoors in peak hours, increasing their sunscreen use, and decreasing sunburns. And it also seems to suggest that these campaigns are actually cost effective. So the data right now suggests that they could actually save $2.32 in return for every $1 spent on the current program. So finally, I'd like to leave you with a few photos. So the New York Times did a series of children reacting to having sunscreen put on. And I'm afraid that probably most adults actually feel the same way about sunscreen and UV protection in general. But hopefully we could develop an intervention for skin cancer survivors that's slightly more palatable. So finally, I'd like to thank my collaborators and their funding sources.